Now let's talk about HIV and AIDS. HIV, otherwise known as the human immunodeficiency virus, attacks the body's ability to protect itself against disease. HIV eventually will progress to AIDS, or the acquired immune deficiency syndrome. On average, within 10 years of HIV infection, this occurs. This time varies greatly from person to person and can depend on many factors, including a person's health status, behaviors, and the medications that they take. But since 1996, the introduction of powerful antiretroviral therapies has changed the natural progression of HIV infection to the development of AIDS. Approximately 1.1 million people in the U.S. are living with HIV infection. It's estimated that over 18% do not know they have it because they've not been tested and they don't have any symptoms. Approximately 50,000 people become infected with HIV every year, and about 15,000 people die every year in the U.S. from AIDS. Of the estimated 50,000 HIV infections diagnosed in 2011, among all adults and adolescents, approximately 62% of them were attributed to male-to-male sexual contact, and an additional 3% of diagnosed infections were attributed to male-to-male sexual contact and injection drug use. An estimated 18% of all diagnosed infections were attributed to heterosexual contact for females and 10% for males. An estimated 5% of all diagnosed infections were attributed to injection drug use for males and 3% for females. Less than 1% of diagnosed infections were attributed to other transmission categories. This less than 1% includes babies born to infected mothers, blood transfusions, hemophilia, sources such as needle sticks, and sources of which we cannot identify. To put the numbers in perspective of what causes the spread of HIV in the United States, out of the estimated total of 50,000 people each year that become infected with HIV, less than 1%, or around 51 cases, are actually related to other exposures like work-related incidences. So what am I trying to say? That out of all of the ways that we've discussed on how a person contracts HIV infection, very few will ever become infected or become sick from HIV due to a work-related incident, as long as proper infection control policies are followed. HIV is a deadly virus that causes AIDS. Symptoms, unfortunately, are unreliable and may or may not be present. A person can actually be infected with HIV or AIDS for many years and not even know they have it. Only proper testing can determine the infection. If symptoms were present, they could include fever, fatigue, night sweats, weight loss, rashes, or a dry cough. The HIV virus is fragile, fortunately, though, and it dies within seconds outside the body when it's exposed to air. The amount of HIV present in the body fluid and the conditions will determine how long the virus lives. HIV is primarily spread by sexual contact with an infected person or by sharing needles and/or syringes. Babies may become infected before or during birth or through breastfeeding. Only a fraction of the less than 1% of the people contract the virus from providing medical care, and that small number is mostly from needle sticks. HIV is not spread by casual contact like handshakes, hugging, doorknobs, or using the same equipment or toilets or water fountains, which is very good for us. There's no vaccine as of today, and there's no cure.